So there's several different approaches. They have to do with genetics and protein mechanisms and RNAs. And there's a lot of different new approaches that have been expanding over the last several decades. And it gives us opportunity now to try to start to understand that genetic susceptibility and predict it. We can't do that right now. We kind of try to pick the drugs that are most safe that we know about, a lot of drugs we don't know. And it's very frustrating when you go through the first set of drugs and for some reason they fail those drugs for side effects. They don't stop the seizures. And now you're trying to pick a new drug and you're doing that with partial information. So that's frustrating. And even women that are taking certain drugs, we don't understand what the relative risks are from a genetic standpoint. There's a lot of other precision medicine kind of things in terms of dosing and changes. I think understanding better what the underlying genetics are. We have some preliminary data we presented an abstract in the last year showing that some genes in the folate metabolism system seem to increase the risk of problems for children. It's the mother has these certain genes in the folate system. The reason we focused on folate because there's lots of genes out there and we're just spanning all the genes that are possible. We focused on that because this data from our study and from some of the Norwegian studies showing that if women are taking folate around the periconceptual time, in the first few weeks of pregnancy, like around the first 6 to 8 weeks of pregnancy, the children have a better cognitive behavior outcome, better IQ and a better language outcome and lower risk for autism. So this is an important thing in planning pregnancies. And since half pregnancies aren't planned, you need to talk about this as soon as you start prescribing a drug to women that might potentially get pregnant. And so we started with that, but there's a whole host of other potential mechanisms that could impact the risk of getting certain birth defects or problems. Even when I look at a single drug and the women are all taking about the same dose, the levels are about the same, we still see a lot of variance in the outcome. You would expect the children's outcome to be close, for like a cognitive outcome, to be close to the mother's. The mother's IQ is the most predictive in the general population and was very predictive in our group too, of what the child's IQ is going to be. But when you see scatter with IQs much lower than the mother's or much higher, and you can't understand why that variance is happening, and that's our goal, is to try to understand that better by looking at genetic factors in this regard and other things like maybe folate intake and those kind of things. In the present study, we didn't see an effect of folate, although I would point out in our prior study that we saw a marginal effect of folate at 3, but then we saw a big effect of folate, periconceptual folate, at 6 years of age. So that's another reason why it's important to continue to follow the kids, because we may be able to see those more subtle things at 6 that we can't see now.